Well, hey everybody, it's Sandy and welcome back to my channel dedicated to helping you advocate for your own health one topic at a time. Yay, it's not a product today. Today I want to talk about ginger. I posed a question a while back about whether it would be helpful to talk about more things integrative, and I think I specifically said about inflammation. And some people were really excited about that and said, yes, please do. I did get a comment though that I did not want to proceed without addressing, and that was kind of like, oh, be careful and let's use caution, because in that whole area of integrative health, there's just a lot of quackery and hocus pocus out there. And I want to say that I agree. And I did not want to proceed without addressing it. I must say that that is actually part of the genesis of this channel. For me, I've always been so interested in all things integrative, but I also don't want to engage in all kinds of quackery either. And I've had a real passion for drilling down and finding out where there's research, what really looks promising, and what just seems like a whole lot of hype. Okay, so that said, I've always proceeded with caution on that. So anything I'm going to say today, I'm going to link down in the description box the scientific studies with citations so that you can take a look for yourself and peruse those. Now, I'm going to say my usual disclaimer, which is that nothing that I say on this channel should be deemed a substitute for medical advice of your own practitioner. I'm not going to be giving any individual medical advice on this channel ever, but I rather would like to help you familiarize yourself with this and then give you tools so that if you want to have this discussion with your own practitioner, you can even print off some of the scientific data I'm going to put in the description box and bring that with. So that said, I'm going to get started. What I'm going to do is tell you a little bit about what ginger is, and then individual benefits of the herb, dosages, precautions you might take, but I'm not going to get all down in the weeds because I'll have that in the description box for you. So ginger is, I used to think it was a root. It is not a root. It is a rhizome, which I think that means the bottom part of the stem. The bioactive compound in ginger that they think is responsible for its antioxidant and anti-inflammatory properties is called gingerol. And when you get supplements of ginger, like over the counter, it's usually in a powder form inside a capsule, and there will usually be either gingerol, or it will tell you grams of the whole ginger, the whole herb. It does come in fresh. Of course, you can use it in your cooking. It's hard to megadose like that. It comes in powder form, as I just described. You can get dried ginger. Some people juice ginger. I actually do green juicing, which is different than like juicing, like with juicy vegetables. It's a different kind of machine even that you use. And I often do add ginger to my green juice. It's a way to get the really powerful, the oil and the liquid out of it without the bulky pulp. So ginger has several benefits, and they mostly relate to either one of two things: the antioxidant action or the anti-inflammatory action. Now, as far as what those are, it is a profound anti-nausea drug. Now, that has been studied. It is particularly helpful for people who have morning sickness, like pregnancy-related nausea and vomiting. Dr. Weil, who I think I've mentioned before on this channel, Andrew Weil, is the founder of the field of integrative medicine. He got his bachelor's degree and his medical degree both from Harvard University, and founded the Integrative Medicine Institute out in Arizona, where he has residency programs for both physicians and nurse practitioners. He did a review of several different scientific studies and found that the ginger significantly decreases the nausea and vomiting associated with pregnancy. It is somewhat helpful possibly for nausea related to other things like chemotherapy. Of course, that's something you'd want to discuss with your practitioner if you are going through that. It is also found to be, with a double-blind placebo-controlled study, to be as effective as conventional medication when it comes to post-operative nausea. So like after surgery when you feel nauseated. It might help reduce pain and soreness, like muscle soreness. That's not so much an immediate thing. So it's not like if you were real sore after a workout, you could pop some ginger and that would go away. It more has to do with a day-to-day progression. But the evidence is weak on that, but it looks like there might be some benefit to preventing muscle soreness. It does have some anti-inflammatory property that might help with osteoarthritis, for example, osteoarthritis of the knee. I found one study that was double-blind, placebo-controlled, and it did find that there was a significant reduction in pain and stiffness for osteoarthritis of the knee. It worked better than the placebo in a double-blind controlled study, and it worked as well as the conventional medication. But that isn't conclusive. That was a very small study, and the conclusion is that it really needs to be studied more. Another benefit of ginger that seems very impressive is that it has a profound ability to reduce or regulate blood glucose, so blood sugar, okay? It will improve heart disease risk factors for the same reason. This probably relates to its anti-inflammatory effect. It was a 2015 study that had 41 participants. Again, these are all double-blind, placebo-controlled. The people in the experimental group were given 2 grams of ginger powder per day as opposed to the other group, and the ginger reduced fasting blood glucose by 12%. And it reduced even the hemoglobin A1C. That doesn't have to be fasting. Hemoglobin A1C is not like other hemoglobin. So for those of you who don't know, it's measured to look at blood glucose over a period of like the last 3 months, because that's the life of a red blood cell. So typically you'd think of, we measure blood glucose by taking your blood sugar, but that just tells us what it is right this minute. If you look at the hemoglobin A1C, it gives a good idea of how well the blood glucose in a patient has been controlled over the whole previous 3 months. The ginger group in this particular study I'm talking about reduced its hemoglobin A1C by 10%. They also measured various markers that are risk factors for cardiac disease and inflammation, and they were reduced by 23 and 28% respectively. So that was a pretty powerful study. And again, I'm going to link all this down in the description box. As a tangent, I will say that if you are pre-diabetic or diabetic, or any of these things actually, I really recommend, I'll link an old video I did, my channel's not so old, but I'm going to link it right here, about intermittent fasting, because I think that the profound anti-inflammatory benefits of intermittent fasting, not to mention its ability to help control blood glucose, just can't be beat. And I think that intermittent fasting is acts as a good underpinning for all of these other integrated things you might do. That's my opinion. Talk to your practitioner about it. Another thing that ginger can do, and this is not so speculative, again, this is kind of like the one I just mentioned about blood glucose. The studies look very promising on this, is that it can help with chronic indigestion. Chronic indigestion is believed to be due to delayed emptying, so when you just feel like so full for hours and you have this all the time. And delayed emptying of the stomach can be extremely uncomfortable, so that has been studied using ginger, and it's been shown to speed up the emptying. There was a study of 24 healthy volunteers. They were given, in the experimental group, 1.2 grams of ginger before a meal, and it accelerated their gastric emptying time by 50%. Okay, so the conclusion in this study was that it accelerates gastric emptying and antral contractions. The antrum is the part of the stomach, and in healthy volunteers. So does that speak to people who are sick or people who have other problems that might complicate this? No, this was a study done in healthy volunteers. Probably begs for more study, but nonetheless impressive. Ginger can reduce menstrual pain. This is one of those things that, again, it was double-blind, placebo-controlled, but a small study. But people were given either ginger powder, ibuprofen, or Ponstel, and what they found was that there was no difference in any of these groups. So the ginger was just as effective as were the anti-inflammatory medications. Ginger might decrease cholesterol. Another double-blind, placebo-controlled study over 45 days that looked at 85 people. They were either given 3 grams of ginger powder a day or the placebo. They were all people who had increased cholesterol. And at the end of the time period, there was a significant decrease in the LDL. That's what's commonly been called the bad cholesterol, guys. That's a little more nuanced now. Like there's different parts, different kinds of LDL, but overall, it's the LDL is considered the one that you want to keep a little lower. The HDL is the one we're trying to keep higher. And again, in the experimental group with the people who got the ginger, had a significantly decreased LDL, a significantly decreased triglyceride, a decreased total cholesterol, and an increased HDL. And that's the part I was actually really impressed with, because HDL, that's the needle that's really hard to move. It's the good cholesterol, they say, the one that's really protective in terms of heart disease. So I thought that was a really interesting study. It does look like ginger has some anti-cancer properties. The gingerol in it may have protective effects. All antioxidants in general, to the extent that it's an antioxidant, are somewhat anti-cancer because they help clean up free radicals. But that's about the extent of it. I didn't really see anything particular or impressive when it came to ginger. It may help improve brain function. Now, some of these studies were done on rodents, on rats, and they were particularly impressive. There was one small study that was done on human beings. It was on 60 middle-aged women, and it did show that ginger improved reaction time and the working memory of these people. That was double-blind and placebo-controlled. Animal studies are the only other ones I found on that, and those would be rats, although very often animal studies, rats are a good cross-reference, to humans, but it's early. Ginger could possibly reduce some kinds of infection risk. Particularly, it does inhibit the growth of the bacteria that cause periodontitis and gingivitis, so gum disease. Now, let me know if any of you have used ginger, how you've used ginger. I'm just going to talk about there are a couple of interactions to be aware of, precautions, and then I'm going to talk about dosages, because those are kind of all over the board. And if you look at the supplements, they're all over the place. So interactions are either moderate or minor. One that's moderate that you do have to talk to your practitioner about is, are you on any blood thinners? Are you on any antiplatelet, anticoagulant drugs? It says in the literature on ginger that it'll increase the risk of bruising. But to my sense, if it increases the risk of bruising, that means it increases the risk of bleeding. So if you're on some of these, you might want to only introduce ginger under some supervision and see how you do. It might potentiate some other drugs like anti-diabetic medications, probably for the reason that I just talked about, where it's somewhat helpful to reduce blood glucose. So if you are on an anti-diabetic regimen, particularly if you're taking any medications, again, you might want to be watching that. If you're going to introduce ginger, then you might want to be getting tested a little more frequently, and so you can work out with your practitioner how you're doing and how it fits into your regimen. And then finally, it might potentiate calcium channel blockers. So those are often used for high blood pressure, among other things. Not every high blood pressure medicine is a calcium channel blocker, but it might even potentiate those. So it could reduce the blood pressure further. It could cause some irregular beats. So these are all things to keep in mind and to discuss with your practitioner, and to be able to watch or maybe keep a journal if you're going to start taking the medication. Dosages are all over the board. So here's what I could find as some very broad guidelines for ginger. The total dosage should not exceed 4,000 milligrams a day. So that's 4 grams. In pregnant people, I read that it should not exceed 1,000 milligrams or 1 gram a day. I'm not sure if that's been studied or if that's just excess of caution because of the state of pregnancy. The doses differ depending on what you're using it for. So for nausea, they say about 1 gram a day divided into 2 doses, so 500 milligrams at a time. For menstrual cramps, could go up to 1,500 milligrams of ginger powder daily divided in 3 doses. So 500 milligrams of a regular old ginger powder 3 times a day. For morning sickness, it was 500 to 2,500 milligrams. That's quite a range, divided into 3 to 4 doses. Osteoarthritis, since the evidence on that was really limited, I didn't really pay much attention to the dose. And the good thing about ginger is that it has a very high safety profile. So if you're okay to go ahead and try this, you can, use a pretty large range of it. Like, again, for a healthy adult, the top is 4,000 milligrams a day. So none of these doses even approach that. So let me know if some of you guys have tried it. Now, one thing that I think that people do a lot is they work in ginger along with turmeric. I did a video not too long ago on turmeric. I'm a big proponent of turmeric, by the way, even more so than ginger. But they are the two anti-inflammatory herbs. Some preparations use them together. I'm personally not a big fan of using a preparation that combines two herbs because you can't manipulate the dosage of each one separately. So I tend to take them separately. Yes, that means more pills, but I do like Solgar brand, and I've mentioned that before. But I am just starting, guys. I want to try a different brand just because of the way I see it's prepared, which is Nature's Way. I've used that product for other things. I'm going to link both the Solgar and the Nature's Way down in the description box. And what I'll have to do is keep you guys appraised if you're interested in how I'm doing with the Nature's Way. I use these for just general inflammation. But let me know what you guys are using it for if you find it helpful. One of the things I think is a problem with some of these herbs that people find, well, this isn't very helpful for me. It just has to do with this. There's just so many out there, and they might or might not be prepared well. They might or might not be a quality product, and it's just so very hard to know. With both Solgar and Nature's Way, I haven't read of any of those situations where sometimes these consumer group, like consumer labs goes in and they study the product and they find it substandard, or they find there's, something in there that's not what the label says. I haven't seen that with either of these two products. I've never seen any kind of scandal with either of these two brands, and I've used them for years, so I trust them. The source I do look at for things like ginger, because sometimes ginger is sourced in China. I personally don't want to buy something that is sourced in China, even if it's made in the United States. You have to be careful with labels because the company might be in the United States and they don't tell you where the product is sourced. So I do look for that in Nature's Way sources from India. So I'm going to link both of those in the description box. For those of you who don't know, I don't do affiliate links on this channel, so anything down there is just for the purpose of helping you find the product. I don't want any bias when it comes to people's health, and I don't want to make money off people's fears. So I'll just have those in the description box for you to be able to navigate over to it. Next, I think I'm going to talk about, people have asked me to talk about some of the masks that I did not review. So that's going to be next. Let me know what you think about this and let me know if it was helpful. Okay, and until next time, be well. Bye-bye.